In this video about peritoneal dialysis, we'll look at what the nurse needs to do the second time they go in the room. This will include the flushing phase and the filling phase. The first thing you'll need to do is close all 3 clamps. Since you last were in the room, the patient should have finished draining their peritoneal fluid. Now that we've drained the patient's abdomen of the dialysate, we need to obtain a dry weight at least once a day and chart that in Epic. Now we need to flush the ultrabag tubing to clear it of the dirty dialysate that's sitting in the drainage line, as well as to move the air out of the fill line so we don't put any air into the peritoneal space. Before we begin, make sure that all 3 of your clamps are in the closed position. When we flush the system, the patient clamp remains closed and will open the drainage clamp and the fill line clamp. We've colored the dialysate blue for this demonstration. Open the fill line clamp last and wait 5 seconds. The fluid runs from the dialysate bag to the drainage bag, clearing the tubing as it moves. When you've counted to 5, close all of your clamps. Now we'll need to fill the patient's peritoneal space with new dialysate. When filling, the drainage line clamp should remain closed. The fill line clamp and patient clamp will be open. With the fill line open and the drainage line closed, fluid will run from the dialysate bag into the patient's peritoneal space. Filling will take 15 to 30 minutes, but you do not need to remain in the room during this period. Return to the room in 15 to 30 minutes, or when the patient tells you that their fill bag is empty.